Thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on Tuesday, July 15th at 8:31 a.m. First item is the approval of the consent agenda. That includes our meeting agenda, minutes from May and June, as well as financial report. Anything you would like to pull to discuss there?
Mr. Chair, I'd like to make a motion to approve the consent agenda.
I'll support.
Thank you. We have a motion and support. Any further discussion? Hearing or seeing none. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Moving on to our director's report. Plowman, we have staff and agency updates.
Good morning, Mr. Chair, members of the Public Health and Human Services Board, others present. I'm here to represent Cook County Public Health and Human Services Agency today. I'm going to start with a couple operational reports, and then I'm going to read through some programmatic reports that have been provided to me by supervisors of our agency. Typically, at this time of the year, we present the preliminary budget for the next year. July is a little challenging for us. It's a little bit early because a lot of the allocations from state and federal funds is still being, this year in particular, is still being determined and calculated. So we are, I have asked Brady Powers to give us a little delay our presentation until sometime in August. So there will be more to come on this. But I have submitted our preliminary budget. There is a lot to narrow down and a lot to still look into that before we have something we can present to this board. So more to come on that. In the last 4 weeks about my work has been, my number one priority has been to continue to provide services to our community. So we have entered in contracts with a couple of our partners. We have signed a contract with the Human Development Center to provide mobile crisis response supervision for our staff and to provide after-hour services when our staff is not available. I thank them for stepping forward and helping us out. We have signed a contract with Southwood Mountain Clinic to provide clinical supervision to our staff. And I understand the first several weeks have gotten as good as well as we could have expected. Southwood Mountain Clinic and their staff have been a long-term partner for our agency, and we appreciate their help and assistance with this. I want to take a minute to thank our staff in Public Health and Human Services who's worked really hard to continue to provide services and guarantee that there's no interruption for this several weeks in the past, and we'll continue to work hard to make sure that that continues to be our goal going forward. Let's see here. Ranna and I and Neil from the County Attorney's Office met with the Grand Portage with Jackie Kozlowski, who is the Public Health and Human Services Director, and Anna Deschamps. Our goal was to reiterate our partnership and cooperation with Grand Portage Human Services, and I thought the meeting was good. It was we wanted to just touch base and set some goals going forward on how we're going to continue to communicate and partner to continue to serve all the clients in Cook County. I thank Grand Portage for taking the time to meet with us, and looking forward to continue this relationship for the future. Now I'm going to go with some of the programmatic updates that I have received from our public health supervisor, Grace Ganager. PHHS staff will be attending the Care Partners Brain Health event outside of the hub on Saturday, July 19th, to share information about initiatives and services within PHHS. Grace Ganager, Public Health Supervisor, presented a mid-cycle community health assessment, community health improvement update at the July 1st Public Health and Human Services Advisory Council meeting. Out from Minnesota shared a presentation at the July 8th Mental Health Advisory Council meeting on the LGBTQ plus mental health. The local Mental Health Advisory Council is interested in an August meeting that looks at the potential impact of federal funding and programming changes to local public health and human services provided in Cook County. Grace Ganager is considering how to best create this type of presentation and will consider whether it could be a joint meeting of both the local mental health and the PHHS Advisory Council. Andrea Orest, harm reduction and prevention specialist, is providing mobile crisis response services and working to build ongoing capacity and infrastructure to support coordinated crisis response services. This is part of a temporary out-of-class assignment that Andrea has undertaken to support the implementation of the Mobile Crisis Response Grant through Department of Human Services. Clinical supervision for these services is being provided through the Human Development Center. Rocio Rivas, Youth Prevention Specialist, attending the Montana Institute on Prevention to deepen her knowledge of the principles of prevention work, with a focus on building up norms, messages, and services that are protective against substance misuse. We received 11 applicants for a public health grant fund for year 2026 for a total of $282,651 in requests. Our PHHS draft budget includes $190,000 towards the public health grant awards. The Public Health Fund Grant Review Subcommittee of the Public Health and Human Services Advisory Council has begun to interview all applicants, agencies, and will develop funding recommendations to the Public Health and Human Services Board at its August meeting for consideration and vote on the Public Health and Human Services Board members. The Prevention Coalition will continue in review meeting this afternoon, at which point we'll also brainstorm goals and activities of focus for the upcoming year. The medication lockbox pilot has entered phase 2, and additional pickup sites active at Care Partners. The public health vending machine will arrive late this week, with plans to place the machine to the right of the elevator on the second floor of the courthouse. Once the machine is operational, we will begin outreach about the project with the community, including a way to gather ongoing feedback from users or prospective users about which items would be most helpful to include. The goal of the pilot is to learn about community needs and use, and plan to reassess after 1 year whether and where an alternate, more accessible location for the machine could be in a community at large. This project is financed entirely by the Rural Communities Opioid Response Grant through HRSA. The Food Access Council met on July 2nd at the Cook County Food Shelf. The meeting focused on a tour of the facility and overview of services provided, along with successes and challenges for the organization. Grace Ganager and Andrea Tofte, in her role as the Disease Prevention and Control Coordinator, met with Ellen Hill, the Northeast Regional Epidemiologist with Minnesota Department of Health, to discuss the updated Minnesota Infectious Disease Operations Manual and to clearly delineate local and state roles for infectious disease prevention and response. That's all updates I have for you today. Any questions?
Commissioner Storlie.
Thank you for that report. Refresh my memory on where the food shelf is. I'm always familiar with the Congregational Church.
I'll have to reach to Grace and confirm, and then I'll get back to you
Yeah,
on that.
okay.
Okay?
Unless it's moved somewhere.
That
Maybe
is,
that
that
the
is where
combo?
it is.
Yeah.
It is there?
Yeah.
Okay. There we go. You have the
Very
answer.
good.
I thought maybe it had moved someplace and I
Yeah,
was
and
missing
I didn't know
something.
either.
Adding something else in there and decided not to. Just
Oh.
keep it with the food shelf,
Keep
as
it,
far as I
okay.
know.
Okay. All right.
Any other questions? Commissioner Campbell?
Yeah, thank you, Mr. Chair. Thank you for your report. My question has to do with the vending machine. We've had discussions on that, and trying to find a location that made sense is something it seems we struggled with, and we've come up with a location that I don't know that if you look at it from all aspects, that it makes sense. And I would question that location, given the courthouse second floor. And the other thing I was going to ask was if we had determined what our product list would be, and it sounds like we're waiting to make that determination. So in some other states and places where vending machines have exist, when you look at that product list, it'd be interesting to see what we project our product list would be. But I would, I know there's the elements that restrict some locations, given our access to power and other things, but I just think second floor of the courthouse is a bit problematic. And I would still try to see if there's any others that are alternative in that regard. Sometimes, and it seems like this decision, sometimes we ignore other priorities we've set because of the convenience and the need to make a decision, and so that's why I would just challenge that maybe we should consider, given some of the other concerns that we address when our focuses are on those other concerns, that we wouldn't make a decision that compromises some of those other things, so.
And Frank, did you have something?
Yes, I'd like to support Commissioner Gamble. Several different things, aside from the fact that you don't have 24-hour access to the upstairs floor. The second part is a social, psychological thing. Not everybody is comfortable walking into the courthouse and finding their way to the second floor. And especially, one of the purposes of the vending machine is that it's anonymous. Well, going up to the second floor of the courthouse is about as far from anonymous as putting it in the police station. So for many people's perceptions. As far as the product list, I think that would be partly seasonal. I know in the winter, they were talking about warm socks, gloves, as well as the evergreen stuff, you know, the fentanyl test strips, the Narcan, the toiletries. So it will and should be seasonal.
Yeah, and I think in any decision, you know, identifying objective and things that need to be considered in making that decision is certainly important, and it's been part of the discussion. And so sometimes I know we were frustrated just trying to find a place, but I think we can't lose sight of the things that we identified initially when we set out to try to find a place. So, thank you.
Commissioner White?
How big is this cabinet? If we're talking about stocking it with mittens and, I was.
Typical vending machine. No, typical vending
Yeah.
machine.
Like a Coke
Wow,
machine.
the whole,
Yeah.
huge.
So you probably could have, what, maybe 20 items at least?
Yeah, okay.
Oh, please,
Well,
Ranna.
we discussed this at the public health meeting one time, and I think this is a starting place for it, not that it would be the permanent place, and with the acknowledgement that it's not perfect, but it's just to see what happens with that. That's my memory of it, that it's ongoing and will be evaluated, and hopefully look for a better place from the standpoint of access, something that's open all the time, can't be outside, you know, all these things, so.
I think it can be outside,
Oh,
though.
you think so?
Yeah, that was my understanding.
Oh, okay.
You know, I'm going to follow up with Brooke. We'd had a conversation about maybe doing something outdoors by the budget shop. I may follow up on that. I think it would involve us putting down some
Yeah.
concrete, but
Yeah,
let me
that
follow
would
up on that.
That would be
I'll
a
follow
great
up on that,
place.
Paul.
Yeah.
I think that'd be a better location. It's a little more anonymous if you came in the middle of the night, or you'd always be available.
Sure, yeah, weekends, yeah.
Commissioner Campbell? Oh, Commissioner White?
But won't we have cameras for security?
No,
No. I mean, we have cameras up there for security.
There are already
There are,
there.
yes.
Right.
So,
Yes.
Some things had to be moved away from cameras because people wouldn't be
Right.
willing to go to it.
Yeah, thank you. Part of the challenge is, again, if you identify what your objective is, why we're doing this, we got grant money so we could put it in, well, that's great, so let's do that. Now, we want to make sure that we position it the best that we can, and monitoring, or we'll say evaluating, is predicated upon whether we made a good choice. And some of our evaluation is going to be skewed by our choice. So we want to be sure that it's an accurate assumption, coming out of what our experience is. So I just think, we have this opportunity, it just have we positioned it the best that we can with all the considerations that go into making this decision, so.
And I think to the point about cameras, there are cameras in the courthouse too, so. And there's pretty much, there are cameras everywhere. Mostly we aren't even aware of them anymore. 'Cause they're just everywhere.
Yeah, and I agree with all that was said, and it's maybe a baby step in a direction, but it's not going to maybe necessarily tell us all that much, like Commissioner Gamble was pointing out. But we do have to implement the dollars, and it is a great, I think, a great idea. It's just finding the right place, and if we have to do it, implement by a certain timeline, and we're going to do this as a baby step, then we can, it's going to be more work to move it again. But one question I had was, did you say Care Partners was a partner in the program too? I mean, there's a new, their building
That
is,
was
so that's maybe something to consider too. But I appreciate the follow-up with Brooke.
I'll follow up both places. I'll follow up with
Yeah.
Care Partners too.
No, another question, does the grant include stocking and possibly building a location for it? In other words, just like a little outdoor kiosk, an open face thing, running electric to it, concrete pad, that kind of thing?
So
Or is
this-
it just the machine?
I apologize. This grant is phasing out now, so
Yeah.
we had to use up the funds
Yeah.
and purchase the vending machine and initial supplies, but they'll have to be an alternative source for continuing to replenish and alternatively moving the vending machine cost and so forth.
So, but it would be okay, installation of the machine for whatever's necessary, running electric or whatever, could be included in that grant? Or is the money already all spent to buy the machine?
There is a little bit of available money, about just over $1,000 that, my understanding was that Andrea Orris was gonna purchase, supplies.
For supplies, okay.
Yes.
So the ongoing maintenance and installation is not included in the grant?
Right. I think installation is just plugging in, unless you need a concrete pad.
Well, I see, unless you're going to put it outside.
Right. Yeah.
Thank you.
Yeah. Commissioner Gamble.
Yeah, thank you. You probably didn't expect to get hit with this much conversation on this particular subject.
That's the purpose of the public meeting.
But what I would say, we've got an opportunity, and we have seen in recent meetings that sometimes we're getting a little push because there's money, but it's a timeline. It's always best to be ahead of that so that we're not driven so much by the sense of urgency. The other thing I would suggest, if we haven't done it, is that if this is the first time that this type of vending machine has ever been employed in a county, if not, then you would think that other counties or other entities that have used this, that we can borrow that learned information to help inform our decisions so we don't follow the same path that might lead us the wrong direction.
I think Boyce Fort has it. Oh, Grace is here. Good morning, Grace. You can answer questions.
Timing is
Yeah.
everything. I was listening to it on YouTube, and I should just come down
Yeah.
and answer some questions about the vending machine. So the vending machine was purchased directly from the University of Minnesota. It's not purchased out of our grant. It's with the HRSA grant, the Rural Communities Opioid Response Grant, is a regional consortium. So we're one of the sub-grantees. And our budget is not paying for the materials or the machine. The University of Minnesota is paying for everything directly. So we do have a product list for how it's built out. And the reason it's going upstairs is because Andrea and Brooke have been doing quite a bit of work with the building committee as well, trying to figure out an appropriate location. And we are looking at this as a baby step because it's proving challenging to find a location that is 24/7 accessible and has some confidentiality. So the idea is to, when it comes, we need to have it somewhere. So we're going to move it upstairs by the elevator. That's the spot that Brooke recommended after looking around all the county facilities and figuring out where there's a power source and a space for it. But that is not going to be its permanent home. And so the idea was to get it here, get all the training on how to use it, to manage the inventory, and then once we have everything settled, to start phase 2. And this isn't this is not how I think we would have envisioned an ideal process, but again, it's coming from the University of Minnesota on their timeline. And so we're trying to figure out how can we get it here, get the training, get what we need to have it start, and then figure out a plan that is in a more optimal site for the community and do that community outreach and engagement as a step 2. I think it would have been more ideal to do it as a step 1 and have it in its ideal location from the beginning. But again, we're on the university's timeline, and so it's showing up this week, whether we want it to or not.
I think we're on a similar page.
Yeah.
And have similar concerns by
Yeah.
everyone, so.
And I think we're, Andrea and I and Brooke have been doing quite a bit of work trying to figure out what's a good baby step to get it here and get staff trained and figure out what a better long-term plan for use and engagement would be. So, yeah, I think we're in agreement that it's not going to have a long-term home up on the second floor of the courthouse, but it is going to be its landing place.
Well, and the first idea was the roof of the courthouse. So this is pretty, this is better than this. Frank, go ahead.
Can it be outside, like in a kiosk, or does it have to be temperature controlled?
No, it can be outside. We got an indoor-outdoor machine.
Okay, great. Great, I think that
It helps a lot.
might be
yeah.
real important for
More,
like,
doubles the options or
Next
more.
step.
Yeah.
Yeah, and
Yeah, we have a lot of outdoors here.
Yeah.
yeah. I mean, there are lots of considerations to an indoor or an outdoor site. So Brooke has been a good support to us in trying to work through what would be an appropriate, both immediate home and long-term home. So I think the search will continue.
Yeah. Are there any more questions for Grace directly?
No, thank you for coming down.
Yeah,
Okay,
sorry
yeah.
to crash the meeting,
appreciate-
but I was listening upstairs and I was like, you know what, I'll just.
I
come down.
better get. Thank you.
Yeah,
The word
sorry.
bail out is appropriate, yeah.
Thank you all.
Thank you.
Feel free to reach out if you have questions as the machine comes in and, you see it upstairs. I'm happy to talk more about it. So,
Great, thank you.
All right, that is the end of our director's report, and now we're moving on to committee reports. Active Living Steering Committee, Commissioner White.
It's just more of the same, always talking about the progress of the Gitchigami and funding, and Commissioner Storlie lives with the activities of what's going on in the West End, and she's quite aware of the additions and things. So that's about, everyone's real upbeat, and it's summer, and leaves are growing, and trees are falling, and they're really happy. It's a very active thing, so there's no negatives, except for funding, of course, but everyone's positive.
Has there been much, and I should ask Mitch this, but has there been much crossover with Parks and Trails and Active Living Steering Committee? I just think about the different
They're all on the same
Okay.
thing. We're all talking, and they're
Yeah.
all interjecting what they're doing.
Okay, thank you. Next one is AUA, Commissioner White.
I have a meeting coming up. It's this week.
Okay, yeah, and we had a presentation from
Yes.
Scott earlier too. Thank you.
It's-
Oh,
What's today? Today's Wednesday?
Tuesday.
Thursday, AEOA, I believe.
okay. And then the next one is Arrowhead Health Alliance. Any update there? Commissioner White.
I just got on that, so no.
Okay. Arrowhead Regional Corrections, Commissioner Gamble.
We meet Friday. Last meeting was sparsely attended. We had a commissioner show up just so we could get a quorum, and then he left right away. And so we didn't do a lot, but I'll give more of a complete report after Friday's meeting.
Thank you. I'm sorry?
And I'll be attending on Friday also.
Oh, okay.
Okay.
Great.
And she can prove that what we're saying is correct.
Or I can add things, make it juicier.
Flavor. Child Care Solutions Subcommittee, Commissioner Storlie.
We'll learn more at Committee of the Whole.
Okay.
We've not had any meetings, so there's where we'll learn all of it, yes.
Okay. Community Health Board, nothing from me. I missed the last meeting. I don't know if Frank, you've got any.
Yeah, no, we didn't have a meeting. We didn't have a meeting this month, and I reported on the previous
Yep,
meeting,
yep.
last meeting.
Thank you. Cook County Food Access Council, got an update from Plowman. Also, I was away for that meeting, so I couldn't say, just got the summary, much just the same as Plowman reported. Next one is the Local Mental Health Advisory Council.
Yes, we had a very long and interesting meeting. It was the, I don't know what the name of it is, talking about the gender changes that people have and how important it is to respect those, to follow what people say if they want to be called a certain name or do certain things. And we had presentations by two people, KQ and Matt. It's from out front Minnesota. And they talked about, it's a statewide organization, advocacy and support, and this is all quite new for a lot of people, but it's definitely a major thing that's going on. And they just stressed how important it is to, again, respect people's requests and to be open to, that, and that will help people feel respected and help people feel a part of the group. And they talked for over an hour, giving all kinds of examples of situations where people had in the past felt, diminished, and that we need to help them feel good about themselves by the way we treat people. And I thought it was a very interesting discussion. I learned a lot from it.
And one thing they did talk about were pronouns. I got part of it, but it's like especially when they came to the them, they, like, them, they. So anyway, but they did a really good job of trying to, I thought it was a great introduction to everything that I don't know. I thought it was very well, it was a good presentation, and it was long.
Yeah, it's very complicated. There's a lot of aspects to it, like learning the words, cisgender, transgender, gender expression, what people wear, what people are expected to do. And it's kind of amazing to me how quickly all this has come about with all these major changes. I think it was very impressive that they are doing this and going around and helping people learn about it. So I thought that was very good.
Yeah. Thank you. Anything else to add there?
I don't think so. I was thinking about, Andrea talked about the mobile crisis. Because they took over our normal meeting time just for their presentation, we had a really quick little update from other people. But I think overall it was very, very helpful for people.
Thank you. Cook County Prevention Coalition, Commissioner White.
Oh, well, that's the most exciting one, because it's a high energy talking about the youth, and they celebrated their 1-year anniversary of being a group, and they're continuing on with, and a lot of this is Andrea Orris and Grace and Andrea, and they're pulling the statistics together, gathering statistics and then pulling them together to do presentations to the community and to the kids, and they're very methodical, but the enthusiasm you can taste it. So it's good.
Thank you. Cook County Restorative Justice, Commissioner Gamble.
They didn't meet last month. They are meeting Thursday.
Okay. Council on Aging, Commissioner White.
Council on Aging, I didn't attend the one yesterday. I was,
Okay.
so I'm sure they're as enthusiastic about the other end of the community population, the older people and the middle people, as prevention. So,
Emergency Preparedness, Commissioner Sullivan.
They have not met. They meet on an alternating basis, but I would take license to talk about a meeting I did attend that impacts public health and human services. I attended the Violence Prevention Center's strategic planning. And both Lindsay Gao, the former director, and Saren Mauchin, who's the new director, were in attendance. And one of the things I've thought was particularly fascinating in relationship to public health and human services and the county organization in general is their analysis of the victims they served and the financial impact to our county that organization has made. When you look at the costs of mental health services, medical costs related to domestic violence, lost productivity, number of days out of work for employers across the county, costs for law enforcement, for the judicial, it was incredible. The estimate is of the 244 victims that they served last year, that impacts the county by $1.2 million. And so I have all kinds of statistics and information, but I just wanted to bring that up in this venue because I think their services for prevention, education, and also in dealing with people suffering from domestic violence really helps our county in many, many ways that we oftentimes don't think about. So I just wanted to give them a shout out.
Yeah. Violence and prevention, right?
Absolutely.
Commissioner Gamble.
Yeah, the 1.2 million, did they explain how that, in other words, cost to our county 1.2 million, that can be 1.2 million, but it's like whose pockets does that come out of?
Right, and that is a variety of groups. Medical care was 977,000, mental health 129,900. Productivity, which would be to employers throughout the county, 178,000. So that brings it up to 1.2, almost 1.3 million.
Yeah.
But they counted number of lost days of work per case, total work days, lost productivity, and then an analysis of insurance costs, mental health costs beyond insurance, and different types of mental health services that would be accessed by these victims. So I, as I was sitting there thinking, I thought it might be a wonderful opportunity for us to have a committee of the whole presentation by the Violence Prevention Center to inform all of us of what they provide to people here in Cook County.
And I think the numbers as to who it impacts, the more, as if we say it impacts our county, our community by 1.2 million, that if we understand how that impact gets closer to our doorstep, the more we tend to pay attention to it. Not that it doesn't matter, but when we say 1.2 million, is that added cost to us, or is it lost revenue for people that are the fabric of our county? So that's why it's
Absolutely.
an important thing. So.
Certainly the costs for law enforcement, for investigation, for housing people for a period of time, for helping the victims. I mean, there are lots of ways it impacts us as an organization and then our county more broadly. So I think those are really good questions, Commissioner Gamble.
Frank, did I see you?
Just to clarify, was this like an annual report meeting or a board meeting?
This was a strategic planning meeting.
Strategic planning meeting,
Right.
thank you.
Thank you for that. That moves us on to Healthcare Planning Committee, Commissioner Storlie.
We did not meet.
Okay, and there's NACO.
Nicole.
Yeah.
We're still circling at 10,000 feet, I tell you. We're not going to land yet. They had a conference. They have a summer and a winter conference. I chose not to go to the summer one, just due to the cost right now. I didn't know what our budget will be for 2026. However, I will continue attending next year, but we brought before that committee in Philadelphia probably 28 different resolutions, and I voted on 3 of them that I felt were important for our county. So that was my input that they took. Other than that, we'll just wait for a review of that conference. And one way I was glad I didn't go there because the Philadelphia City union were on strike, and so the utilities and everything were a real mess. But they settled right the day before NACO arrived, so. It still wasn't in shape, but, they did settle. Anyway, that's where it was this year, so. More to be explained next month.
Bated breath, for sure, but thank you. Yeah. Northeast Minnesota Office of Job Training, Commissioner Gamble.
I had 3 meetings happening at the same time, and so I was not able to attend that. The meeting that I did attend was the Ty Blacknick discussion, our strategy session on that, and an important element in just understanding how we're going to approach that. That's involving St. Louis County, Lake County, and Cook County in that discussion. It was held in Lake County, so we'll be following up on that. Bob in the assessor's office is, working very hard on that element, as have the other counties. But we have our upcoming meeting for the Northeast Minnesota office. Job Corps will be coming this month, and I'll report on that at that point.
Okay, thank you. North Shore Collaborative did not meet. And then we have the Public Health Human Services Advisory Council. Frank.
Thank you. We did indeed meet, and one of the main presentations on the agenda was Grace gave an overview of the community health assessment and community health improvement plan. We're in the mid-year correction phase of a 5-year process. I'm not going to go into that in great detail because that was essentially the same presentation that she gave to the committee of the whole. There were a couple other things. The clinic gave a brief talk about the telehealth, the bright spots, and the telehealth program is continuing at a lesser pace than it was during COVID. COVID is still here, but I think you know what I mean, during the COVID public health emergency. But the particular bright spots are some parts of some medical conditions can be done via telehealth. And most significant is behavioral health. There's been a very positive upswing and increase in usage in telehealth for behavioral health. Again, doesn't fit everybody in all circumstances, but it's one more arrow in the quiver. So I wanted to mention that. We did have a brief discussion about the vending machine, and we'll certainly be updating them about what we learned today. But along with that, kind of like a phase 2, would be expansion of what I call is like the mini dispersion points. In other words, just like we have in the restrooms here. Just a little cabinet, stocked with a few things. Much less expensive than a $15,000 vending machine. And much easier to locate in other parts of the county to cover the 2/3 of the citizens who don't live in the city of Grand Marais. And some of the suggestions that came up was in the community centers, in the vestibule, because the community centers up Gunflint Trail are accessed by a key code, but the vestibule is open. And likewise, the fire halls are controlled by key access, but the vestibule is not. So, and certainly, I'm just familiar with the Gunflint Trail area. When we come to that stage, I would like to seek input from the rest of the board about places that you know of in your areas, which could house a small cabinet with some few drawers of supplies and make it available throughout the county. The big news this month is working on the grant program. As Playman already suggested, we have started interviewing grantees. We have 12 grantees this year, a couple new ones, which is always good to see. And we are in the process here. We've interviewed 6. Tomorrow we interview the final 6. And the day after that, we start meeting on scoring. When we last had the discussion of the budget and the overall financial information, we saw that the Cook County Council on Aging, the hub, has been a major applicant and recipient of these funds. And I had asked the board to take particular note of that, everybody's like 10, 15, 20, 100. So it's way beyond the median, mean, any kind of central tendency you want to use. And I asked the board to consider how that might be funded in the future, because they do provide essential services. And I understand that they have come and they have made a budget request for a line item for $150,000. And I would like to give our support to that consideration as you consider the budget. They have also made a grant application in the amount of just shy of $110,000 for a grant. As Playman said, we're budgeting $190,000, and Hub is asking for $110,000. Obviously, if they are included as a line item, that will certainly affect the grant committee meeting and the grant application. But I did want to underscore that, about how important that is, and considering that the budget decisions, but the grant applications will be tentatively our recommendations, because it's the board that votes on them, but our recommendations will be done before the budget is set. It would have to be a contingent award, what they would receive in the event there is not. And other than that, we'd have to make adjustments between the line item and what they're asking for from the public health discretionary grant.
And they have hired a grant writer who will be, they're working, Northland Foundation has grant opportunities, and that's one that they, I mean, they just got started on it. I know that from a month ago, so.
Yeah.
So they're not giving up on
Oh, no.
anything at all, so.
Oh, no. And part of the application for the public health grants, we do ask them to list grants they've received or income they've received from other sources, prospectively, as well as what's already been awarded. So, yeah, that we like to see that, that they're not just relying on county funds.
Right.
Thank you. Commissioner Campbell.
Yep, thank you, Frank. I think it's important to be mindful of the fact that as a county, we have ways of coming alongside organizations and helping them that don't necessarily translate directly to levy dollars. In other words, it can translate to dollars, but it doesn't mean that it has to be levy dollars. It just means we come alongside to try to help organizations be more financially supportive in what they do. I think an example that comes to mind would be our highway department. When we've had presentation on the highway department, we see what we're doing with recommendations in staffing. Some of the alignment of staffing has allowed our highway director to be able to generate significant dollars because of that focus. And I think, the comment about, let's just say, have you considered grants? And here's some grants that might be applicable in your particular area. And those are things that I think we can do. And we've seen significant dollars come into the highway department because of a focus on trying to resource those dollars. And I think that's an area where we can come alongside organizations to try to help them help themselves. So that's that on that subject. The other thing we did in our meeting was discuss encouraging others that might want to participate in our board, and you'd put forth, you know, a letter to that regard, and I would just ask if we've seen any response at all to that call out for individuals that might want to sit on that board,
And which board?
on the advisory board.
Oh, yes, that's right. We have formed a subcommittee looking for outreach.
Yeah, yeah.
And a letter will be going out shortly. We're taking a brief pause on that because we've been so active with the grant writing.
Yeah.
And it's the same people going back to the well all the time who are doing this.
Yeah.
So we've decided to leave it for about 2 weeks before those letters will start going out.
Okay, all right. Thank you.
Thank you. Last item is for the good of the order. I just wanted to give a couple updates. I've continued to attend the Department of Children, Youth, and Families Intergovernmental Advisory Group, which is kind of been going through the implementation of DCYF at the state level, transferring services from DHS and Department of Corrections and various, state departments, and that transition has been, by and large, very smooth. There were a lot of concerns before the steps for implementation have been taken, and the approach that DCYF has taken is there's no wrong door for questions or who to talk to, because that was kind of the primary concern is we've worked with this department or this person for so long, now what do we do? And, there was a lot of nervousness there, but I'd say a lot of success, and things have calmed down. Come October now, via state law, there's the Intergovernmental Advisory Council, and so that's going to be the long-standing group that advises the commissioner of Department of DCYF. And so there's going to be some transitions there. I think we have 5 more meetings before that begins, and there's going to be a call out for commissioners to apply for that and to join that, which I would highly recommend if there's interest there. Certainly a lot of opportunity. And then the other one that I'm just kind of subbing for, our previous administrator had joined the Northland Climate Collaborative, and so that was in Grand Portage this last go-around. And so I went up there and attended that, and that's a great, what a enthusiastic group of people. Much like Commissioner White has explained with a couple of her groups, this is probably the most enthusiastic group that I've been a part of, and just a lot of expertise. There's people from NOAA there. The group is largely led from St. Louis County, but it's absolutely including all the tribes and the other counties in the region, and trying to get all the different perspectives there. So, I did not attend any of the tours, but they toured a little spirit tree via water, as well as, I don't know what else they saw on the water, but I thought that was pretty unique. And then also the farm that they have up Mineral Center, as well as the bison. I don't know if they saw bison or not, and then I happened to be serving at the Angry Trout that night, and so had to get back, and then they came and ate there, and I got to be their waiter, so that was kind of fun. And
Any hats?
Yeah, it caught them off guard.
Buffalo?
No one had any bison. Yeah, I think it was all fish across the board there. Yeah, but that was pretty fun to be able to wine and dine them too. So, but yeah, that was the good of the order. Anyone else, Commissioner Storlie?
I just want to add to that, ARDC, Arrowhead Regional Development Commission, was able to receive this group with a grant. They have money for 4 years. And they are just hitting the pavement, and they're going gangbusters. I wasn't able to attend on Wednesday. I had another commitment, but just reading what they're doing and meeting with the group once in a while when we have our meetings in Duluth is just very encouraging that we can all, maybe in 4 years, be able to carry on a lot of what they're initiating right now, because we all live by Lake Superior. Yeah. And that's really an important thing, plus other areas too, but yeah. Thank you for going, appreciate that.
Well, and I wasn't sure I was going to make it, but then the emphasis in Grand Portage is like, okay, I have to make this. And one of the points that I'd like to, I guess, bring out of that meeting is just a lot of the concerns about redundancy as far as we don't need to reinvent the wheel. There's a lot of different organizations in our region that have climate action plans, and if we can, learn from each other and see what other communities are doing, just to try to be more efficient there. There's certainly a concern too about sifting through all of the plans, so there's just kind of what's more efficient sort of thing. But there's an awareness there of, not wanting to spin wheels and just do it to do it, there wants to be kind of this collaborative effort. So I thought that was pretty wise. Any other things? I don't think there's anything else regarding that. Any other for the good of the order items today? Commissioner White?
A correction, AHA, Arrowhead Health Alliance.
Yeah.
They can't, I've been on that one, that's the one down at Yellow Leaf.
Yep.
Yeah, they didn't have one in July, they couldn't get enough people together, so they're doing it in August.
Well, that's right, actually, because, I was also contacted and I was not available either, and so,
There we are.
Yeah, a couple strikeouts there, but, thank you. All right, well, with that, we are adjourned. Thank you.
Thank you.
And I was on that board.
Very close, if not,
You know,
And I get
I
this
was
phone call,
leadership
and
is
that was
always
my
an
meeting for
issue.
yesterday.
Yeah.
And
Some
Doug
of